Schizophrenia. Schizophrenia is a serious and chronic mental illness that affects a person's thinking, emotions, and behavior. It is a complex disorder that can cause people to experience a range of symptoms, including hallucinations, delusions, disorganized thinking, abnormal behavior, and difficulties with memory and concentration. The exact causes of schizophrenia are not yet fully understood, but it is thought to be a combination of genetic, environmental, and neurochemical factors that contribute to the development of the disorder. Schizophrenia is typically diagnosed in late adolescence or early adulthood, and it is a lifelong condition that requires ongoing treatment and management. While there is no cure for schizophrenia, medications and therapy can help to manage symptoms and improve the quality of life for people living with the disorder. What is psychosis? Psychosis is a mental state characterized by a loss of contact with reality. It is a symptom of several different mental health conditions, including schizophrenia, bipolar disorder, and severe depression. During a psychotic episode, a person may experience hallucinations, which are perceptions of things that are not actually present in the environment. They may also have delusions, which are false beliefs that are firmly held despite evidence to the contrary. Other symptoms of psychosis can include disorganized thinking and speech, difficulty concentrating, changes in mood or behavior, and a lack of motivation or interest in activities. How do you describe delusions? Delusions are false beliefs that are held with strong conviction, despite evidence to the contrary. They are a symptom of several mental health conditions, including schizophrenia, bipolar disorder, and some forms of depression. Delusions can take many different forms, but they generally involve beliefs that are not based in reality. For example, a person may believe that they are being persecuted or monitored by an organization or government agency, or that they have a special connection to a celebrity or historical figure. They may believe that their thoughts or actions are being controlled by an outside force, or that they have special abilities or powers. Delusions can be very distressing for the person experiencing them, and they can also lead to unusual or even dangerous behavior. Hallucinations. Hallucinations are sensory experiences that seem real but are not based in reality. They can affect any of the senses, but the most common types of hallucinations are auditory, visual, and tactile. Auditory hallucinations involve hearing sounds or voices that are not actually present. These voices may be perceived as coming from inside the person's head or from outside sources. The voices may be critical or derogatory, or they may provide commands or guidance. Hallucinations. Visual hallucinations involve seeing things that are not actually present. These may include people, objects, or scenes that are not there. Visual hallucinations can be very vivid and realistic, and they can be very frightening for the person experiencing them. Tactile hallucinations involve feeling sensations that are not actually there. These may include sensations of crawling or itching on the skin, or the feeling of being touched or grabbed by something that is not there. Hallucinations are a symptom of several mental health conditions, including schizophrenia, bipolar disorder, and some forms of depression. They can also be caused by certain medical conditions or by the use of drugs or medications. Hallucinations can be very distressing for the person experiencing them, and they can also lead to unusual or even dangerous behavior. Disorganized thinking and speech. Disorganized thinking and speech is a symptom of several mental health conditions, including schizophrenia, bipolar disorder, and some forms of depression. It is characterized by difficulty organizing and expressing thoughts and ideas in a coherent and logical manner. People experiencing disorganized thinking and speech may have trouble staying on topic and may jump from one idea to another in a way that seems random and disconnected. They may also use neologisms, made-up words, or repeat the same words or phrases over and over again. Other symptoms of disorganized thinking and speech can include difficulty with word salad, in which the person's speech may be incomprehensible, and loose associations, in which the person's speech may be tangential and may not make sense in the context of the conversation. What is disorganized or abnormal motor behavior? Disorganized or abnormal motor behavior is a symptom of several mental health conditions, including schizophrenia and some forms of bipolar disorder. It refers to unusual or bizarre movements or behavior that are not appropriate to the situation. Examples of disorganized or abnormal motor behavior can include strange postures or facial expressions, repetitive movements, and inappropriate or exaggerated gestures. People experiencing this symptom may also have difficulty with tasks that require coordination, such as walking or using utensils to eat. Other symptoms of disorganized or abnormal motor behavior can include catatonia, which is a state of unresponsiveness or immobility, or echolalia, which is the repetition of words or phrases spoken by others. What are the negative symptoms? Negative symptoms are a group of symptoms that are often associated with schizophrenia and other mental health conditions. They are called negative because they involve a loss or absence of normal functions or behaviors, rather than the presence of abnormal ones. Some examples of negative symptoms include apathy, a lack of motivation or interest in activities that were once enjoyed. 1. Avolition, difficulty starting or completing tasks, or lack of initiative. 2. Anhedonia, an inability to experience pleasure or enjoy activities. 3. Social withdrawal, a tendency to isolate oneself from social situations. 4. Blunted affect, a lack of emotional expressiveness, including facial expressions and tone of voice. What is the difference between schizophrenia and multiple personalities? Schizophrenia and multiple personalities, now called dissociative identity disorder, are two distinct mental health conditions with different symptoms and characteristics. Schizophrenia is a chronic and severe mental health condition characterized by a combination of symptoms, including delusions, hallucinations, disorganized thinking and speech, and disorganized or abnormal motor behavior. People with schizophrenia may also experience negative symptoms, such as apathy, avolition, and social withdrawal. On the other hand, dissociative identity disorder, DID, is a condition in which a person has two or more distinct personalities or identities that take control of the individual's behavior at different times. These identities may have different names, ages, genders, and even accents or physical characteristics. While schizophrenia and DID may share some symptoms, such as hallucinations, they are different conditions with different underlying causes and treatment approaches. Schizophrenia is typically treated with antipsychotic medication and psychotherapy, while DID is often treated with a combination of therapy, medication, and supportive care. It is also worth noting that DID is a controversial diagnosis, with some experts arguing that it is overdiagnosed, and that the symptoms are actually the result of other conditions, such as trauma or personality disorders. What is the difference between schizophrenia and psychosis? Schizophrenia is a chronic and severe mental health condition characterized by a combination of symptoms, including delusions, hallucinations, disorganized thinking and speech, and disorganized or abnormal motor behavior. It is a specific diagnosis that falls under the broader category of psychotic disorders. Psychosis, on the other hand, is a symptom or set of symptoms that can occur in several different mental health conditions, including schizophrenia, bipolar disorder, major depressive disorder, and some types of substance use disorders. Psychosis is characterized by a loss of contact with reality, and can involve hallucinations, delusions, disordered thinking, and abnormal behavior. In other words, schizophrenia is a specific disorder that involves psychosis as one of its defining features. While psychosis can occur in several different conditions, including schizophrenia, it is also worth noting that not everyone who experiences psychosis has schizophrenia. In fact, many people experience a single episode of psychosis, often as a result of drug use or a high level of stress, and do not go on to develop a chronic psychotic disorder like schizophrenia. Who does schizophrenia affect? Schizophrenia can affect anyone, regardless of age, gender, ethnicity, or socioeconomic status. However, it typically first appears in the late teenage years or early adulthood, with men usually developing the condition earlier than women. While the exact causes of schizophrenia are not fully understood, research suggests that a combination of genetic, environmental, and neurological factors may be involved. Some of the factors that may increase the risk of developing schizophrenia include 1. Family history. People who have a family member with schizophrenia are more likely to develop the condition themselves. 2. Brain chemistry and structure. Some studies have suggested that imbalances in certain neurotransmitters in the brain, as well as structural changes in certain brain regions, may be involved in the development of schizophrenia. 3. Environmental factors. Exposure to certain infections, stressors, and toxins during pregnancy or early childhood may increase the risk of developing schizophrenia. 4. Substance use. Substance use, particularly marijuana and other psychoactive drugs, has been linked to an increased risk of developing schizophrenia. It is important to note that while some risk factors for schizophrenia are beyond an individual's control, there are also several factors that can reduce the risk of developing the condition, such as maintaining a healthy lifestyle, seeking treatment for mental health conditions, and avoiding substance use. How common is schizophrenia? Schizophrenia is a relatively uncommon mental health condition, with a worldwide prevalence of approximately 1% of the population. However, it can have a significant impact on those who are affected by it, as well as their families and communities. The onset of schizophrenia usually occurs in late adolescence or early adulthood, with men typically developing the condition at a slightly younger age than women. It is estimated that approximately 0.4% to 0.6% of the global population will develop schizophrenia during their lifetime. The incidence and prevalence of schizophrenia can vary between different regions of the world, with some studies suggesting that the condition is more common in urban areas and in certain populations, such as those who have experienced trauma or migration. While schizophrenia is relatively rare, it can have a significant impact on the individual's life and those around them. Early intervention and treatment can improve outcomes and quality of life for those living with the condition. How does this condition affect my body? Schizophrenia is primarily a mental health condition that affects a person's thoughts, perceptions, and behavior. However, it can have some physical effects on the body, particularly if the individual is not receiving appropriate treatment. One of the most significant physical effects of schizophrenia is the potential for side effects from antipsychotic medication. These side effects can include weight gain, diabetes, high blood pressure, and movement disorders such as tardive dyskinesia. It is important for individuals with schizophrenia to receive regular medical care and to make healthy lifestyle choices to minimize the potential physical effects of the condition. What conditions fall under the schizophrenia spectrum? The conditions that fall under the schizophrenia spectrum include: 1. Schizophrenia. Schizophrenia is a chronic and severe mental health condition characterized by a combination of symptoms, including delusions, hallucinations, disorganized thinking and speech, and disorganized or abnormal motor behavior. 2. Schizoaffective disorder. Schizoaffective disorder is a condition that involves both symptoms of schizophrenia and symptoms of a mood disorder, such as depression or bipolar disorder. 3. Brief psychotic disorder. Brief psychotic disorder is a condition in which an individual experiences a sudden onset of psychotic symptoms, such as hallucinations or delusions, but these symptoms typically last less than a month. 4. Delusional disorder. Delusional disorder is a condition in which an individual experiences delusions, but does not have the other symptoms of schizophrenia, such as hallucinations or disorganized thinking. 5. Schizophreniform disorder. Schizophreniform disorder is a condition that involves symptoms of schizophrenia, but the duration of symptoms is shorter, typically between 1 and 6 months. 6. Shared psychotic disorder. Shared psychotic disorder, also known as folie à deux, is a rare condition in which an individual develops delusions that are similar to those of another person who already has a psychotic disorder, such as schizophrenia. 7. Catatonia. Catatonia is a condition that can occur in individuals with various mental health conditions, including schizophrenia and mood disorders. It is characterized by a range of symptoms that affect a person's movement and behavior. The symptoms of catatonia can include stupor, a state of unresponsiveness where the person is motionless and appears to be in a trance-like state. Catalepsy, a state of immobility or rigidity, where the person's limbs may be held in a fixed position. Waxy flexibility, a condition where the person's limbs can be molded into different positions and held in place. Mutism, a state of silence where the person does not speak. Negativism, a tendency to resist or oppose suggestions or commands. Stereotypy, repetitive movements or gestures. Agitation, restlessness or excitement that can lead to aggression. All of these conditions involve symptoms of psychosis, such as hallucinations and delusions, and can have a significant impact on the individual's life and functioning. Early diagnosis and appropriate treatment can improve outcomes for people with these conditions. What are the early symptoms of schizophrenia? Schizophrenia is a complex mental health condition, and its symptoms can vary widely from person to person. However, there are some common early symptoms that can indicate the onset of the illness. These symptoms can include 1. Changes in thoughts or perceptions. Individuals with schizophrenia may experience changes in the way they think or perceive the world around them. This can include experiencing unusual or illogical thoughts or beliefs, hearing or seeing things that are not there, hallucinations, or experiencing a sense of unreality or detachment from their surroundings. 2. Social withdrawal. Early signs of schizophrenia can include a decreased interest in socializing or participating in activities that were once enjoyable. 3. Changes in behavior. Individuals with schizophrenia may display changes in their behavior, such as increased anxiety, decreased motivation, or difficulty with self-care. 4. Changes in mood. Early symptoms of schizophrenia can include changes in mood, such as a depressed or flat affect, a lack of emotional expression. 5. Difficulty with concentration or memory. Individuals with schizophrenia may have difficulty with concentration or memory, which can interfere with their ability to complete tasks or remember important information. It is important to note that experiencing some of these symptoms does not necessarily mean that someone has schizophrenia. Many of these symptoms can occur in other mental health conditions or can be caused by other factors, such as substance use or medical conditions. However, if you or someone you know is experiencing these symptoms, it is important to seek medical attention to determine the cause and receive appropriate treatment. What are the positive symptoms of schizophrenia? The positive symptoms of schizophrenia are those that involve an excess or distortion of normal functioning. They are called positive symptoms because they add something to a person's behavior or experience that is not typically present in people without the condition. The positive symptoms of schizophrenia can include 1. Hallucinations. The person may see, hear, smell, taste or feel things that are not real. The most common hallucination experienced in schizophrenia is hearing voices. 2. Delusions. The person may hold false beliefs that are not based in reality. These can include paranoid delusions, believing that someone is plotting against them. Grandiose delusions, believing that they have special abilities or powers. Or religious delusions, believing that they have a special relationship with God or a higher power. 3. Disorganized thinking and speech. The person may have difficulty organizing their thoughts or expressing them in a coherent manner. This can lead to jumbled or illogical speech, word salad, or derailment, where the person changes the subject in the middle of a conversation. 4. Disorganized or abnormal motor behavior. The person may display unusual or inappropriate behavior, such as strange postures or gestures, unpredictable movements, or lack of response to their environment. Positive symptoms can be distressing for the person experiencing them and can interfere with their ability to function in daily life. Treatment for schizophrenia typically involves a combination of medication and therapy, which can help manage the positive symptoms of the condition and improve quality of life. What are the disorganized symptoms of schizophrenia? The disorganized symptoms of schizophrenia are a group of symptoms that can affect a person's behavior, thoughts, and speech. These symptoms can be classified as negative symptoms or cognitive symptoms, and are characterized by a loss of normal functioning or organization. The disorganized symptoms of schizophrenia can include 1. Disorganized speech. The person may speak in a way that is difficult to follow or understand. This can include switching topics frequently, making up words or phrases, or using words in unusual ways. 2. Disorganized behavior. The person may display behavior that is unusual or inappropriate for the situation. This can include unusual postures or movements, unpredictable behavior, or lack of response to their environment. 3. Flat affect. The person may have a lack of emotional expression or display emotions that are not appropriate for the situation. 4. Allergia. The person may have difficulty with verbal communication or may be unresponsive in conversations. 5. Avolition. The person may have difficulty with motivation or may lack the ability to initiate or complete tasks. Disorganized symptoms can interfere with a person's ability to function in daily life and can be distressing for the person experiencing them. Treatment for schizophrenia typically involves a combination of medication and therapy, which can help manage the symptoms of the condition and improve quality of life. What are the cognitive symptoms of schizophrenia? The cognitive symptoms of schizophrenia are a group of symptoms that affect a person's thinking, memory, and ability to focus. They can have a significant impact on a person's daily life, making it difficult to perform tasks, maintain relationships, and work or study effectively. The cognitive symptoms of schizophrenia can include 1. Difficulty with working memory. The person may have trouble remembering information in the short term, such as instructions or phone numbers. 2. Difficulty with attention. The person may have trouble focusing on tasks or may become easily distracted. 3. Executive dysfunction. The person may have difficulty with planning, problem-solving, decision-making, and other complex cognitive processes. 4. Impaired learning. The person may have difficulty learning new information or may have trouble retaining information over time. 5. Slowed processing speed. The person may have difficulty processing information quickly or may have a slower response time. Cognitive symptoms can be challenging to manage, but treatment for schizophrenia typically involves a combination of medication and therapy, which can help improve cognitive function and overall quality of life. Cognitive remediation therapy, in particular, can help improve cognitive skills and functioning in people with schizophrenia. What are the negative symptoms of schizophrenia? The negative symptoms of schizophrenia are a group of symptoms that involve a loss or decrease in normal functioning. They are called negative symptoms because they involve the absence of something that is typically present in people without the condition. The negative symptoms of schizophrenia can include 1. Affective flattening. The person may have a reduced range or intensity of emotional expression. 2. Allergia. The person may have difficulty with verbal communication or may be unresponsive in conversations. 3. Avolition. The person may have difficulty with motivation or may lack the ability to initiate or complete tasks. 4. Anhedonia. The person may have a decreased ability to experience pleasure or enjoyment in activities that they previously found enjoyable. 5. Social withdrawal. The person may have a reduced interest in social activities or may isolate themselves from others. Negative symptoms can be particularly challenging to manage, as they can have a significant impact on a person's quality of life and ability to function in daily life. Treatment for schizophrenia typically involves a combination of medication and therapy, which can help manage the negative symptoms of the condition and improve overall quality of life. Psychosocial interventions, such as social skills training and supported employment, can also be helpful in addressing negative symptoms and improving functioning. What causes schizophrenia? The exact cause of schizophrenia is not fully understood, but it is believed to be a complex interplay of genetic, environmental, and neurological factors. Some of the factors that may contribute to the development of schizophrenia include genetics. There is a strong genetic component to schizophrenia, as the condition tends to run in families. However, no single gene has been identified as the cause of schizophrenia. Brain chemistry and structure. Research has shown that people with schizophrenia may have abnormalities in brain chemistry and structure. Specifically, there may be an imbalance of certain neurotransmitters, such as dopamine and glutamate, which are involved in regulating mood, cognition, and perception. Environmental factors such as exposure to stress, trauma, and substance abuse, may increase the risk of developing schizophrenia. Developmental factors. Some research suggests that exposure to infections during pregnancy, complications during birth, or early childhood experiences may increase the risk of developing schizophrenia. Risk factors. It is important to note that while these factors may increase the risk of developing schizophrenia, not everyone who has these risk factors will develop the condition. Likewise, not everyone who develops schizophrenia will have all of these risk factors. More research is needed to fully understand the complex causes of schizophrenia. How is schizophrenia diagnosed? Schizophrenia is typically diagnosed by a mental health professional, such as a psychiatrist or psychologist, who will conduct a comprehensive evaluation to assess symptoms and rule out other possible causes. The diagnosis of schizophrenia typically involves a combination of the following. 1. A thorough medical and psychiatric history. The mental health professional will ask the person about their symptoms, medical history, and family history of mental illness. 2. A physical exam. The mental health professional may perform a physical exam to rule out other medical conditions that may be causing the symptoms. 3. Psychiatric assessment. The mental health professional will conduct a psychiatric assessment to assess symptoms and determine if they meet the criteria for schizophrenia. This may involve asking the person about their thoughts, feelings, and behaviors, as well as performing cognitive and neurological tests. 4. Diagnostic criteria. The mental health professional will use the criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, to make a diagnosis of schizophrenia. The DSM-5 criteria for schizophrenia include the presence of 2 or more of the following symptoms for a significant portion of time during a 1-month period. Delusions, hallucinations, disorganized speech, disorganized or catatonic behavior, negative symptoms. 5. Rule out other conditions. The mental health professional will also rule out other possible causes of the person's symptoms, such as substance use, medical conditions, or other mental health disorders. Overall, the diagnosis of schizophrenia can be complex and may require ongoing assessment and evaluation to ensure accurate diagnosis and effective treatment. What tests will be done to diagnose this condition? There are no specific tests to diagnose schizophrenia, but the diagnosis is typically made based on a combination of a person's symptoms and a thorough medical and psychiatric evaluation. During the evaluation, the mental health professional will typically ask questions about a person's symptoms, medical history, and family history of mental illness. They may also perform a physical examination and order blood tests or other diagnostic tests to rule out other medical conditions that could be causing the person's symptoms. Additionally, the mental health professional may perform a psychological assessment to assess a person's thought processes, emotions, and behaviors, and to evaluate whether they meet the diagnostic criteria for schizophrenia. MRI, CT scans. Imaging studies, such as magnetic resonance imaging, MRI, or computed tomography, CT, scans, may also be used to evaluate brain structure and function, although they are not typically used as a primary tool for diagnosing schizophrenia. Spinal tap, also known as lumbar puncture, and ECG, electrocardiogram, tests are not routinely used to diagnose schizophrenia, as they are not specific to the condition. However, in some cases, they may be used to rule out other medical conditions that can cause symptoms similar to those of schizophrenia. A spinal tap is a procedure that involves removing a small amount of cerebrospinal fluid, CSF, from the spinal canal for testing. The test can help identify certain infections, inflammation, or bleeding in the brain or spinal cord. An ECG is a test that records the electrical activity of the heart to evaluate its function. It is not a routine test for schizophrenia, but it may be used to evaluate the effects of certain medications used to treat the condition that can affect heart function. In addition, some medical conditions that can cause symptoms similar to those of schizophrenia, such as thyroid disorders, may also be evaluated with an ECG. blood tests can be used to check for levels of certain substances that may be related to schizophrenia, such as antibodies against specific viruses or markers of inflammation. Overall, the diagnosis of schizophrenia is based on a comprehensive evaluation of a person's symptoms and medical and psychiatric history, and no single test is definitive for diagnosing the condition. How schizophrenia is treated, and is there a cure? There is currently no cure for schizophrenia, but the condition can be effectively managed with treatment. Treatment for schizophrenia typically involves a combination of medications, psychotherapy, and support services to help people manage their symptoms and improve their overall quality of life. Medications used to treat schizophrenia are often called antipsychotics, and they work by blocking or reducing the effects of dopamine, a neurotransmitter that is thought to be involved in the development of psychotic symptoms. There are two main types of antipsychotics, typical and atypical. Typical antipsychotics are older medications that are generally effective in reducing positive symptoms of schizophrenia but can have more severe side effects. Atypical antipsychotics are newer medications that are generally preferred because they are less likely to cause side effects but may be less effective in reducing positive symptoms for some people. Psychotherapy can also be an important component of treatment for schizophrenia. Cognitive behavioral therapy, CBT, can help people learn to manage their symptoms and improve their coping skills. Family therapy can also be helpful in improving communication and relationships between family members and the person with schizophrenia. Support services, such as vocational rehabilitation, social skills training, and peer support groups, can also be helpful in managing symptoms and improving quality of life. These services can help people with schizophrenia learn skills to manage their symptoms and improve their ability to function in daily life. Overall, while there is currently no cure for schizophrenia, with appropriate treatment, many people with the condition are able to effectively manage their symptoms and lead fulfilling lives.